So now may I introduce our speaker for this session of IOL 101. So our speaker, Dr. Alvin Marcelo, is a general and trauma surgeon by training and is currently the director of UPM SILab. He has over 25 years of experience both in the field of health informatics and academic surgery. He is a director treasurer of the Asia eHealth Information Network, or the AHIN. He's also a convener of the AHIN Community of Interoperability Labs, or the AHIN COIL, and the president of the Philippine Society for Digital Health and a director at the Asia Open RAN Academy. At the University of the Philippines, Manila, Dr. Marcelo held various posts such as Director of the National Telehealth Center and Chief of the Medical Informatics Unit. He co-established the Master of Science in Health Informatics program and conducted local and international research in the field of e-health and health information systems development. All right. So without any further ado, to present us the role of standards and interoperability in the Philippine Digital Health Strategy and to give us the update on the Philippine Digital Health Summit, which was held last March 2024, let us virtually welcome Dr. Alvin Marcelo.
Thank you, Gabby. Good morning, everyone. Thank you, Manu, also for inviting the participants to the Committee of Practice. This is a webinar that we're offering today, and there will be a series from here on to also engage the local community on the standards and interoperability efforts of the Department of Health, PhilHealth, and all the other public and private stakeholders in the country. So some disclosures, I don't have any financial interests in any of the technologies presented. However, I need to disclose that we are a recipient of grants from the Commonwealth Scientific Industrial Research Organization, or CSIRO, and the Department of Foreign Affairs and Trade of the Australian government. This is basically what's fueling the SILab team right now, called Strengthening Standards Capability Project, and we hope that you will become part of the SSCP later on. It is a 3-year project, and we've just in our first 6 months, and we are very optimistic on the other activities that we will be offering to you in the audience on regards standards and interoperability. We also are receiving funds from the Department of Science and Technology, PCHRD, for a prototypical study on how artificial intelligence can be used for precision diet control. We divided the talk into 2 parts. The first part is about the Philippine Digital Health Summit, which was held earlier this year, and about the Philippine Digital Health Strategy. After that, we will tell you more about our lab and how our lab is mobilizing to respond to the challenge and the request of the Department of Health and PhilHealth with regards their digital health activities. So the Digital Health Summit was held last March 6 to 8 at Makati Diamond Residences with support from the Asia eHealth Information Network and the UNICEF. Of course, this is led by the Department of Health with support from the Japanese government, Digital Square, Bill and Melinda Gates, and PATH. But before I talk about the summit, let's backtrack to about 2012 when a group of participants in a WHO conference gathered together. There were 7 of us, and we agreed amongst ourselves that this interoperability problem is difficult to address, and we need to bring our heads together. We talked to some officials from the World Health Organization, and they agreed to support this fledgling network back then, which we later called the Asia eHealth Information Network. The goal of the Asia eHealth Information Network was to support their respective national governments when it comes to standardization and interoperability. So we started with 7 people from 6 countries, and now we are more than 2,400 members with presence in 84 countries. The vision of AHIN is to strengthen interoperable digital health ecosystem for better health in Asia by promoting learning, resource sharing, and knowledge exchange to strengthen the digital health approach through networking. We have four strategic areas identified: promoting leadership and governance for digital health, facilitating capacity building for digital health, and that includes you in the audience, create opportunities for knowledge exchange and resource sharing, and that's Manu's call for the community building, and enabling interoperability through standards. This is the distribution. There's a bias towards the Philippines, of course, also Indonesia. But we also have members from Canada and the United States because they are very interested in how we are developing our own regional approaches to solving our local problems. We have a special group within AHIN called the Working Council. These are 2 to 3 people per country who have volunteered their time to advise the Asia eHealth Information Network on what things might be relevant in terms of topics, training, and capacity building within the region. Bottom line, after 12, 13 years, we have summarized the things that are relevant in terms of standardization and interoperability in the country, and we call this the AHIN Mind the Gaps, Fill the Gaps framework. Essentially, distilling that the problems and challenges of interoperability is because of a lack of governance, a lack of architecture, a lack of people and good program management, and a lack of access to standards that are needed to achieve interoperability. So in August of 2023, we released a white paper, basically a call to action to our members, both in government and private sector, that for governance, for them to institutionalize a sustainable, inclusive, resilient, and collaborative digital health governance mechanism. For architecture, for the countries to implement an integrated and standardized digital health blueprint that is aligned with the national health and digital vision and strategies. For people and program management, two parts. First, to establish a digital health transformation or collaboration office, and to advocate and implement measures to improve digital health literacy of providers, health workers, and even the patients, and the use of digital health products and applications by families and communities, and for standards to achieve interoperability by adopting standards. And one of the tools that AHIN developed is what we call a convergence workshop. So with support from WHO, Asian Development Bank, and UNICEF, way back in 2015, we came up with a methodology where an MOH or Ministry of Health led event uh, is established where they gather public and private sector, and the public and private sector listen to government's national e-health strategy. And within that workshop, the public and private sector participants raise their hands and they say, we will support you here in this part of your strategy. So AHID helps by co-designing the program with the MOH, by sharing templates from previous convergence workshops, inviting resource persons from within the country and from other countries, and then facilitating the sessions in the actual workshop. And we've had varied results and outputs, very relevant uh, products that come out of our convergence workshop. One would be an MOH-led multi-sectoral governance structure. In most countries, this does not exist. So after the convergence workshop, they clearly see that the MOH is the leader, but they need help from the other sectors like the Ministry of ICT, the Ministry of Social Welfare, the Ministry of Finance, Ministry of Education. So that multi-sectoral approach is actually one of the innovative byproducts of convergence workshop. Second, some of them come up with a blueprint, and this is a blueprint that becomes the guide for all the participants in the audience. They find themselves in the blueprint and they see their transformation that they need to undergo from the current state to the future state, maybe 5 years from now, from that blueprint. Then they agree on a regular coordination mechanism so that all of them can come together every 3 months, every 6 months, so that they can update each other of what's happening. with regards their assigned component in the blueprint, and they agree that there should be standards, and if it needs to be procured and acquired and subscribed, then an investment is made to acquire the standard. The first convergence workshop was in Naypyidaw, Myanmar, the capital of Myanmar, in 2015. And right after that, we've had a lot of other convergence workshops in Bhutan, Indonesia, Vietnam, Timor-Leste, Nepal. A second one in Myanmar, a second one in Bhutan, Lao PDR, Sri Lanka, and Indonesia. Such that by November 2023, when a team from the Department of Health, Knowledge Management, and Information Technology Services participated at the AHIN General Meeting in Jakarta, Indonesia, we had a side meeting there with Dr. May Velasco, and we explained the convergence workshop methodology to her. By December 2023, when Dr. May Velasco returned and explained the process to Secretary Ted Herbosa, in a National Digital Health Steering Committee meeting, Secretary Herbosa approved the conduct of a convergence workshop in the Philippines for 2024, but he requested that the title be called Philippine Digital Health Summit. So once AHIN received that letter requesting for support for the convergence workshop, which is now called the summit, we got support from UNICEF, and we started planning. During the planning process in December, sorry, we agreed that there needs to be some pre-work to be done to prepare the Department of Health stakeholders for the summit proper in March. So we held a pre-workshop in Marco Polo Ortigas on February 22. Make sure that they understand what a convergence workshop is all about and what their responsibilities will be as Department of Health officials. And finally, we had our Digital Health Summit proper at Makati Diamond Residences on March 6 to 8. This is our splash page for the Digital Health Summit. And in the next few slides, I will present the proceedings that came out of the Philippine Digital Health Summit. The objectives of which were to provide an overview of the Philippine Digital Health Strategy coming from the Department of Health, emphasize the importance of digital in enhancing health services, and aligning the key DOH digital health projects with the universal healthcare principles and the 8-point action agenda. So this was hosted by the Department of Health, UNICEF Philippines, and AHIN with the goals that I already mentioned. This was our group photo in the summit, and these are the pictures from the breakout sessions in the both in the pre-workshop and in the summit proper. So within the summit, the Philippine Digital Health Strategy was presented. During that time, the current DOH Chief Information Officer was Dr. Eric Tayag, Undersecretary Eric Tayag. But I'm now presenting the slides, which are more updated, coming from the new DOH Chief Information Officer, Dr. Emelisa Perez Chong. But the slides are more or less similar. The strategy starts with a situational analysis of our current challenges in maternal mortality, infant mortality, tuberculosis, people living with HIV. So if you see red arrows, that means we are deteriorating. The health sector performance is not moving towards improvement, but rather into deterioration. And this was a slide coming from DOH to basically just set a baseline that these are not very good numbers and we need to start improving. So the challenge that came from DOH is we should stop the deterioration and reverse towards improvement. These are the challenges of the Philippine healthcare system: access to healthcare services and access to reliable information for decision making. They reference a document from the Asian Development Bank on what are the challenges in the health system, inefficiencies, and what are the possible solutions to these inefficiencies. The DOH subscribes to a monitoring system that is performed internationally. One of them is the Network Readiness Index, and the other one is the Global Digital Health Monitor. So the Department of Health, accomplishes this survey once a year, and this is what they use to measure our improvement when it comes to digital health. Some baseline data just to uh, fix the challenges and to put numbers that 43% among Filipinos are computer literate only, and 59% of private primary care facilities do not have electronic medical records, and more than 2.3 million households still do not have access to stable electricity. The other challenges are 63 out of 70 DOH retained hospital implementing telemedicine, but the implementation of telemedicine in the private sector are not yet captured. Only 6% of health facilities are connected to the internet. Uh, the COVID-19 pandemic, despite all of the challenges that we experienced, also fast-tracked the digitalization journey. A lot of people started using telemedicine and became familiar and comfortable with telemedicine. And there were new business models that were created. Of course, we are all familiar with the Universal Healthcare Act. This is RA 11223, which specifies that Filipinos should be guaranteed equitable access to quality and affordable healthcare goods and services and protected against financial risk. And part of this, uh, health information systems will play a big role in making sure that the Filipinos have access to those types of quality information. Then Secretary Ted Herbosa, in the first few days of his tenure, released the 8-point action agenda. And if you drill down to number 3, he mentions the use of teknolohiya para sa mabilis na serbisyong pangkalusugan, basically giving a directive for all of us to use technology to improve the services that we're offering to our countrymen, so that by 2040, the vision of the Department of Health will be achieved, that the Filipinos are among the healthiest in Asia. Then Secretary Ted focused on 8 priority health outcomes. He said, we have a lot of problems in the country, but let's choose the first 8 to focus on. And he selected immunization, and basically giving a directive to use digital health to increase fully immunized children to 95% from the current 72%. He said, use digital health for nutrition to decrease stunting to 13.5% from 27. Use digital health for WASH by increasing percentage of population with access to safe water from 88% to 100. He said, use digital health to decrease maternal death to 111 from the current 154. Use digital health to achieve zero TB case mortality rate from 34. Use digital health so that 85% of people living with HIV would be diagnosed. 85% of those diagnosed will be receiving ART, and 85% of those receiving ART achieving viral suppression. For number 6, he said, use digital health to decrease death rate attributed to road injuries to 4 per 100,000 population from a baseline of 8. He said, use digital health to increase coverage for hypertension and diabetes mellitus management, and use digital health to increase early detection, screening, and treatment of cancer. There are 4 strategic interventions identified by DOH: increase efficiency and productivity in service delivery by harnessing digital health technologies, streamlining administrative processes and data management in the DOH and health sector through digital transformation, improving benefit payment processing through leveraging data services and innovative technologies, and engaging the private sector in the digitalization initiatives in healthcare. Here is a very simple Venn diagram from the Department of Health showing the health domain on the right and the technology domain on the left, and the intersection is called digital health. where cost-effective and secure use of information and communications technologies in support of health and health-related fields happen. This is a roadmap that was started way back in 2013 when Secretary Enrique Ona back then established the National eHealth Governance Structure 2013. Several activities from phase 1, phase 2, phase 3, and now we are in the uh, Bagong Pilipinas, and we are crafting our strategy from 2024 to 2035. The key digital health interventions of the new age right now is follows the gaps process of AHID as well. So for governance, they want to have sustained governance of the Interagency Digital Health Steering Committee, technical working group, and expert groups. They wish to implement legal and technical frameworks to support safe, secure, ethical, and responsible use of digital technologies for health, including costed implementation plan. For architecture, the adoption of the Open Health Information Exchange as an interim architecture for universal health coverage, a promulgation of standardized and interoperable digital health interventions. For people and program management, the establishment of a digital health transformation office, which I think they will now be calling the Office of the National Coordinator. Obtaining support from public and private sector, civil service organizations, and building a cadre of health information technology staff in all CHDs and healthcare provider networks. And finally, building digital health infrastructure with the necessary standards required to achieve interoperability. In terms of digital health governance, the Department of Health has been calling for these meetings. Last year, there were two digital health steering committee meetings and two technical working group meetings. This is the structure right now of the steering committee. It is co-chaired by the Secretary of Health and the Secretary of ICT. I've attended some of these steering committee meetings, and Secretary Ivan Uy and Secretary Ted Harbosa were in the same room presiding over the meeting. The members are the Undersecretary for E-Government, Yusek Dave Almirol, the Undersecretary of the Philippine Statistics Authority, USEC of DOST, the CIO of Department of Health, which is USEC Emmy Perez Chong, the CIO of PhilHealth, which is SVP Jovi Aragona, the CIO of UP Manila, delegated by Chancellor Mike T, and a representative from the Department of Budget Management. The technical working group is presided over again by the DOH KBITS director and the director of the Government Digital Transformation Bureau of the ICT. They have a core group there composed of DILG, PhilHealth, ULAP, AMHOP, Provincial Health Officer Association of the Philippines, Management Association of the Philippines, PISAC, DOST, PCHRD, NIH, and ARTA. And then they invite as stakeholders the Philippine Digital Medicine Society, USAID, DSWD, LCF, AHIN is a member of the TWG, GTAP, PSA, and the World Health Organization. In terms of the expert groups, there were a lot more expert groups during the tenure of Secretary Ona, but Secretary Ted Herbosa now has consolidated them into four. The Health Enterprise Architecture Standards and Data Management Experts Group, of which the PhilHealth and HDR team are very active here. The eHealth Services and Applications Experts Group, for which the DOHK meets eHealth Systems Group is very active here. The Health Data Privacy and Cybersecurity Experts Group, which are being reconvened, and the eHealth Capacity Building Experts Group, which is being facilitated by UP Manila. Now, you've heard about the 8-point action agenda. You've heard about the 8 priority health outcomes. Now, here are the 8 Tier 1 projects. These are the most important projects in the next 5 years. The first is the DOH digitalization, basically the transformation within the Department of Health. The second is the health human resources for health workforce database. The third is the electronic medical record implementation and RISE, which is the replacement or the new version of the FHSIS. The fourth is the National Health Data Repository, which is being led right now by the Philippine Health Insurance Corporation with strong support from the Department of Health. The fifth is the National Health Information Exchange, being led by KMITS. The sixth is the Universal Health Coverage Integration Sites and Provincial and Citywide Health Systems. Basically, the digital health activities that are happening at the local level. The seventh are digital vaccinations, and the eighth would be healthcare financing systems. And in this slide, you will see who are the organizations leading these processes, who are participating, and what particular objectives in the 8-point action agenda they're addressing. I mentioned earlier that DOH has adopted the Open Health Information Exchange as an interim architecture. So this is the OpenHIE architecture. At the bottom, you will see the point of service application. So these are actually the software that are being used right now in the different facilities in the country, public and private sector. So this will be electronic medical records, mobile apps, laboratory systems, radiology systems, logistics management systems. And right now they're basically working as standalone, operating separately from each other. There's no interoperability. But the OpenHIE architecture recommends to create an interoperability layer where all of these point of service systems will connect. And from the interoperability layer, they will have access to registry services, which are reference registries, like a client registry, where you can find one unique number for every person or patient. There's a facility registry where you will find one unique number per facility, public or private. You will find a health worker registry where you will see one unique number per health worker, and a product catalog and a terminology service. Once the interoperability layer connects the point of service to these registry services, then the higher components at the top will be populated by standardized data, because the data from the point of service passing through the interoperability layer going up to the registry services, there will be checks on the data quality. And now we will have a national logistics management information system. We can have a national shared health record. We can have a national health management information service and a national finance and insurance service. So the arrows that you see are the agencies that are responsible for the different parts of the OpenHIE architecture that you see on the screen. And they went further, the Department of Health, and identified which of the specific agencies or existing applications map with the OpenHIE architecture. So they assigned the ICT for the interoperability layer, and then DOH will take care of the registry services. They're in the process of acquiring SNOMED, which is a short for systematized nomenclature of medicine, a very comprehensive set of standardized codes for medicine terminology, which can also be used for public health. They're promoting the PhilSys digital national ID system for the client registry. They will beef up the NHFR, or the National Health Facility Registry, which already exists. They are planning to connect the health workforce registry, the HRH database, with the PRC database to make it better and higher quality. And they will engage the Food and Drug Administration to release a product catalog for use by the different point of service systems. And the NHDR at the top is the most urgent because it is in the UHC law, Section 31, that the PhilHealth will establish a national health data repository. And that is where a lot of the work of the National Digital Health Technical Working Group and Steering Committee are focused right now. Finally, DOH calls the stakeholders to action for the public and private sectors to align their medium-term priority initiatives with the Philippine Digital Health Strategy 2025 to 2028 and sustain engagement and collaboration for digital health. For healthcare provider networks to commence organizing your local health ICT governance structure, to monitor and adopt the standards published by DOH and PhilHealth, and there are many circulars already from the DOH and PhilHealth website on these. I've mentioned them already. And number four, to start using existing government technologies such as the eGov app, the PhilSys ID, the National Health Facility Registry, the PRC system, the Health Workforce Registry, and connect them into your point of service systems. After the presentation in the summit of the Philippine Digital Health Strategy, several development partners expressed their support, and some of them are on the slide. Our own Chancellor in UP Manila, Chancellor Mike T, offered the UP Manila support for professional pre-service training and even professional in-service training after the health workers are deployed. The Philippine Health Insurance Corporation, represented by its President and Chief Executive Officer, Emmanuel Ledesma Jr., expressed support to the National Digital Health Strategy and PDP Philippine Development Plan. In conclusion, yeah, it might be difficult to remember everything. Just remember 888, the 8-point action agenda, the 8 priority outcomes: immunization, nutrition, maternal care, TB, HIV, hypertension, DM, road safety, cancer, WASH, and then the 8 tier 1 projects, which we are showing here mapped over the OpenHIE architecture. If you can remember this 888 and find yourself, look for yourself inside that 888. That's what we need to do together in the next 5 years. And finally, the summit made the recommendations to regularize the governance steering committee meetings and TWG meetings, establish the office of the National Coordinator for Digital Health because there are so many projects to coordinate. So we need somebody to be orchestrating this. We asked DOH to recruit digital health experts. There are so many in the local community. We just need to bring them together and bring their heads in one room and get them to think about how to solve the different problems that we're facing in the 8 priority outcomes. Come up with a very clear, costed digital health blueprint based on OpenHIE so that we can start spending money on the key tier 1 projects of the Department of Health and PhilHealth, particularly investing in the key registries in like the health workforce facility and terminology, and to monitor and update our progress every 6 months. Finally, because there was a transition from Yusek Eric Tayan, who was there during the summit, and then DOH Undersecretary, new CIO, Emmy Perez Chong, by October 4, August 29, I'm sorry, August 29, we turned over the report to Yusek Emmy Perez Chong, and she accepted the output of the summit. Now, after the summit, around October 1 and 2, during the Asia Pacific Association for Medical Informatics, it was now DOH CIO Emmy Perez Chong who was delivering the Philippine Digital Health Strategy as I have presented earlier to the group. So what is the role of standards interoperability? 5 more minutes. Because we think there's a need for all the stakeholders to come together, know each other, build trust, and know what is this interoperability all about. We formed the UPM SILab. The problems are the same. We have the same problems within the hospital. We have interoperability problems. How much more will we have problems with interoperability across different facilities? Our systems are fragmented. We don't have standardized data because they're not standardized. They're not interoperable. We don't have we have limited capabilities for research, and therefore we don't have data for decision making. So we think the solution, well, 10 years ago, we thought the solution was technology, but now I think the solution is really about people. So we started with building a team of people. We have a multi-sector executive board. We have NIH Director Eva Kuchonko, Telehealth Acting Director Art of Teco, Dr. Jadus Ong, a renowned hepatologist, Dr. Harry Hamoy, Dr. Philip Foliante, and then the lab team now led by Manu, with Burr, Paolo, CJ, JR, and we have a secretariat, Gabby, Bianca, and Jayan. We think that this group of people will make themselves accountable to making sure that the community is built. Because if it's just going to be us, we won't be able to do it. It needs to be done by all people, public and private sector, willing and understanding the importance of health data exchange, and why we have to do it securely and ethically. So our mission is make sure that the right data is made available to the right people, whether they are providers or patients, at the right place and at the right time, and make sure that confidentiality, integrity, and availability of the data is assured every time. The process, thankfully, was already provided for us by the World Health Organization. They released the SMART guidelines, which is short for standards-based, machine-readable, adaptive, requirements-based, and testable. So it's a very systematic five-step approach on how to convert your existing national policies into machine-readable formats. So we'll have a separate session on the WHO SMART guidelines, but just know that we are not creating a new thing. We're just implementing something that the WHO recommends. You will already see the OpenHIE framework. That's our reference framework. And we summarize the work that we do in the lab into the 5 T's. The first T is teaming, basically bringing people together, the doctors, the nurses, the clinicians, the pharmacists, with the IT people, the EMR developers, the suppliers, the vendors, the software programmers. From there, we facilitate consensus building on how we understand the national policies. And then we go back and start creating software. We call that tooling, the second T. Once the tools are available, then we start calling people for training. There are 2 parts to train here. The first part are the EMR developers, and the second part are the clinicians using the EMR. Finally, we have testing. Once we have trained the people, we start testing whether the tools are performing correctly. And then we transfer all our technology to the Department of Health and PhilHealth because they are really the bearers of the standard. So in support of our vision and mission, we organized a digital health roundtable last October 14. We invited USEC Emmy Perez Chong and CIO Jovi to share their respective visions and strategy to the development partners. Thankful to CSIRO and DFAT for supporting this activity, and the attendance of WHO, UNICEF, and other UN agencies in this event. Here, we heard what were the plans of the development partners so that we can align them again in that OpenHIE architecture. And then we had October 14 to 15, a small group of people, but very strategic, from PhilHealth, DOH, and UP Manila, undergoing the Fire Fundamentals workshop. They will be your trainers later on when we start offering our own Fire Fundamental workshop to the participants in the call. So please stand by and join the community of SILab so that you can see calls for the next upcoming Fire Fundamental workshops for you. And then we had October 16 to 17, Terminology Services Connectathon. It's just a taste of what interoperability might look like when it comes to the terminology component of interoperability. This is not yet client registry, this is not yet facility, not yet worker registry. This is just a terminology. How to create a value set, how to deliver that to an electronic medical record over HTTP. This is our roadmap. I won't delve into this in detail, except that it will follow the 5 T's. We're embracing the mind the gaps and fill the gaps, and these are our stakeholders. And I think that's the end of my presentation, and we'll open the floor for questions from the audience, which you can Send, you can type your questions. I think there are some questions in the chat box, Manu.
All right. Thank you, Doc Eloy, for that. So we have learned about the efforts of both the private and public institutions in the digitalization of healthcare in the Philippines. We also learned about the roles of each agency and stakeholder in the OpenHIE architecture framework. And we've learned about the 888 or the 8-point action agenda, the 8 priority outcomes, and the 8 tier 1 projects of the Department of Health. Now I'm opening the floor to questions and questions from the group Q&A. So again, you have three options. You may either use the raise hand function if you want to unmute yourself. You may type in your questions in the chat box, or you can also use the Q&A button of the Zoom. All right. So here, sir, we have question which was sent anonymously. So, what are your recommendations for researchers or developers who will be creating apps or systems to ensure that these developed points of services technology will be ready for interoperability? So, for example, the use of languages or data standards or agencies to consult or collaborate with.
Okay, so if we go back to Manu, maybe we can show the OpenHIE architecture. Um, if you're a researcher and you're creating an application, uh, I think the most important question is what terms are you using in your research? So usually, you develop your own data dictionary in your research because, well, of course, there's nothing coming from government except ICD-10 and RBS for PhilHealth claims. But and then if it's not in ICD-10, if it's not in RBS, then you'll have to create your own data dictionary. My recommendation is number one, if you are using laboratory tests or laboratory results in your research, look at LOINC, LOINC.org, LOINC.org. They have a comprehensive code set for laboratory tests. So if your research, you're collecting CBC, hemoglobin, or you're collecting ketones, or you're collecting hemoglobin A1C, rather than just using HbA1c in your system, you might want to look at loic.org and use the code set there. Why? Because there are actually different HbA1cs and different ways of collecting hemoglobin. So Lloyd actually has a different code for hemoglobin that was extracted using this method, or hemoglobin that was extracted using this method. So because there are different ways hemoglobin is determined. So that's my first recommendation. My second recommendation is to start looking at SNOMED. So you can go to snomed.org, SNOMED.org, and look around. Um, SNOMED, inside SNOMED, there are 300,000 different concepts. And inside SNOMED, the whole LOINC database is inside SNOMED. Why am I not yet recommending that you use SNOMED? Because we don't have a license yet. LOINC is license free, so you can start using it right now. But SNOMED requires a license that only the Department of Health can acquire for the country. So we are presently helping the Department of Health acquire a subscription to SNOMED. But you can start looking at it, so that you can get familiar. I think Burr, who is in the call, is our terminology specialist. We will offer another webinar on SNOMED and terminology. And you might want to subscribe to that webinar so that you can see more about the power of having a multi-axial terminology. Next would be, if you are collecting patient identifiers, try to use the PhilSys API. So the Philippine Statistical Authority already released an API for person ID. So you might want to apply for that. Of course, if you're a researcher, you want to separate the identifiers and then you give them a pseudo ID number, which is just a number in your research. So I know you know how to do that already, but you also want to make sure that you have consistency of the identifiers of your patient. So make sure to study the PSA API for person ID. For facility registry, go to nhfr.doh.gov.ph and look for the code for the facility. It's already there. For health worker registry, this is a little tricky because all of us will have a PRC number, and you can use the PRC number for now until the official health workforce registry coming out of DOH is finished. For the product catalog, we're still in the process of obtaining it from the Food and Drug Administration, but it will become part of the terminology services. So that's my advice. Use standards where they are already available. Gabi, is there another question?
Thank you, Doc Eloy. I saw Miss Dr. Juno raising her hand earlier. Yes, Dr. Juno, please unmute
Go
yourself.
ahead, Doc Juno.
Hi, good
Morning.
morning.
Good
I'm a
morning.
good morning. I'm a DTTB from the Noble Hall. I am also involved with the Provincial Health Office of Bohol, trying to review our health information system. So one of the questions that has been raised during our program implementation review in the province is that um the problem with the existing EMR that the province is using is inherently the system. Parang lag. There are many technical issues with the system we're using, and there is a consideration of possibly transferring or adopting a private EMR. However, the current situation is that since hindi pa talaga established yung interoperability between systems, this is a big uh, parang challenge or a hindrance towards trying to achieve universal healthcare in the context of DOH's goals. At the same time, wala pang available validation mechanisms for private EMRs to achieve what, 'di ba? Parang to be validated by DOH. Parang the other existing EMRs in the market are only PhilHealth accredited for consulta. So maybe I wanted to ask, like, how is CLab stands or how is PSDH parang um assisting the development of these standards and or um parang these processes that's really parang making the bottleneck, no, parang I mean contributing to the bottleneck of improvement of our health information systems, particularly in the interoperability. Thank you.
Okay. Thank you for that question. That's a relevant question. A lot of people have asked us that question. Can we change an EMR? The answer, of course, is yes, but it's very difficult. It's very difficult, especially if you have a lot of data already in the existing system. So what we do here is we use the enterprise architecture approach. The enterprise architecture approach is look at your existing system, look at the target system, and see your transition from the current system to the target system. Okay, what's the target system right now? It's the National Health Data Repository. Why? Because it is required by law. Section 31 of the UHC law states that all EMRs that exist right now must be able to transmit data to the NHDR. Focus on that. Focus on that. Why? Because this existing EMR that you're using, they need to be compliant to the NHDR. This new system that you're looking at, private sector EMR, they also need to be sending data to the NHDR. Now, here's the beautiful part. If all of these EMRs become NHDR compliant, then your transition will be easier later on because all of them are NHDR compliant. And therefore, your current system, You submit your data to the NHDR, then your new system can download that same NHDR format into the new system, and then you start checking whether the new system actually has a complete set of your data. That's the time you can say, I can transfer to a new EMR. Transferring a new EMR without getting your data is going to be difficult because you're going to have to leave your old data in the old system. So my suggestion is focus on the law. There is a compliance right now for all EMRs to be NHDR compliant, and we have to put them to the task. Whether that's a government EMR or a private EMR, are you NHDR compliant? If you are, then you will be interoperable with each other, and later on, the data will be also exchangeable with each other, and it's easier to transfer from one EMR to another, whether public private or private to public or private to private. NHDR muna, Dr. Juno, focus on the NHDR.
Thank you, Dr. Eloy. So it's already 10 a.m. Maybe, sir, the last question would be how far are we from being an HDR compliant?
Okay, so without preempting, and this has been pronounced by PhilHealth already in many public events, they are going to launch so there's a step-by-step process to the NHDR, no? First is you should have, and this is not a process that we're only doing in the Philippines. This is also a process that's happening in all other countries that are also setting up their own NHDRs. They call it National Electronic Health Record in other countries. First, there should be a core data for interoperability, CDI. So this is just a list of core data that are important to the country. Last name, first name, birthday, diagnosis, procedures, laboratory tests. So those are the CDIs. Once you have these CDIs, you convert them into machine readable format. And the other countries, they use the HL7 FIRE format. So once the CDI becomes HL7 FIRE format, it is now called the core. So it's a little confusing. I got confused. Took me about 6 months to understand this. You have the core data for interoperability. It's just a wash list of the data that are important to you. If you make that FIRE format, you will now call it the core. So the PHCDI, if they become FIRE format, it's not difficult. No, if you take the FIRE fundamental scores from SILab, you will know how to do it. It becomes the PH core. Once you have the PH core, then you look at the policy. Are we using the use case? Are we using the immunization use case? Are we using the nutrition use case? Remember the 8 priority outcomes? Are we using the maternal use case? For each use case, you will now create a maternal care profile and implementation guide using the PH core. Okay? Then, or you will have the immunization, fire profile, and implementation guide using the PH core. Or you will now have the cancer, fire profile, and implementation guide using the PH core. And because all of these 8 priority outcomes are using the PH core, the interoperability is made possible. So what was the question? I forgot the question. How far?
How
So
far are we?
are we are far, but not as far as last month. Okay. I think the PHCDI, we've seen it. It will be launched second week of November. Then that will then be converted to PH Core. I think government will recruit experts to do that. I hope SILab will become a participant in the conversion of that into PH Core. Again, this is not rocket science. Other countries are already doing this, Korea, Taiwan. Once there's the PH Core, I think the hard part is the use case. Because you need to spend time for each of those 8 use cases. We don't know the plans yet, but I think the use case of PhilHealth is surveillance and DOH, no? So of the 8, the surveillance there is TB HIV. Tama? So TB HIV out of the 8 will be the one priority. I think the TB fire profile and TB implementation guide and the HIV fire profile and the HIV implementation guide will be the first to come out. Once that comes out, then we will do the testing. No, we will call all of the people, EMR developers, guys. Lumabas na yung fire profile for TB and HIV. Can you now create the tools inside your EMR? It's not so difficult. No, once the EMR developers are trained on HL7 Fire, they can easily do this. And then maybe 3 months later, 6 months later, then we do the connectathon. Now we start seeing and checking whether they are actually able to exchange TB data and HIV data securely and ethically for legitimate purposes. Once the testing is done, then voila, we can now say go live. We will now go live with the legitimate exchange of TB and HIV data for purposes of public health. And then that's it. I think I'm not from PhilHealth, so maybe we should just ask PhilHealth what are their timelines. But the NHDR will have a soft launch next year, Q3. And then the first use case may be 2026 first quarter. But don't quote me on that. We'll have to check with PhilHealth for the official timelines. But that is a better thing than 1 year ago. We didn't even know what's going to happen, you know. So now we have more or less, alam na natin yung step-by-step CDI, core, implementation guide. So now we know how far we are. We now know that we will run a 400-meter race, and we are now at the 50-meter mark. Over.
Thank you, Doc Eloy, for that. And also thank you to our participants for their valuable contribution during the Q&A session. So now, moving on, may I invite everyone to please turn on their camera. Let's have a group photo before we formally end this session. And
Thank you. Thank you, Dr. Jonas, for joining us.
all right. So let's just wait for a few more seconds for other people to turn on their camera.
So I see the call also, Bona Ray. She was there at APAMI, and then Dr. Punzalan was there at the Connectathon. Pauline, hello Pauline, Del Mundo.
Hello po.
Dr. Bacchiano was also in the Connectathon. Thank you for joining. Dr. Pimi, Roy, Junel, Ma'am Cynthia, CIOFF, thank you. Okay.
Okay, let's have a group photo in 3, 2, 1, smile. One more. We have another batch. In 3, 2, 1. Okay. So just quickly, let's wave to the camera para lang may added spice to the documentation. So let's wave in 40 seconds.
Para mabide.
All right. Okay. So thank you so much, everyone. Wait, let me just share back my screen. Ayan. Okay. So again, thank you all for joining us today and making this session a success. Remember, the conversation doesn't have to end here, so you may join our Slack channel, join the #webinars channel. Just install the app and feel free to connect and reach out to one another and continue the discussion. Again, here is the updated schedule of our second leg of webinar series this 2024. So we hope to see more familiar faces in the next session.